Hello, hi, and this is Sonal, and I am speaking to you on behalf of Science for People Foundation. Today, we are going to actually follow a very famous neurosurgeon. His name is Dr. Jaydev Panchavad. He is director and chief neurosurgeon at Synapse Brain and Spine Foundation. We are all interested that actually how a neurosurgical operation theatre looks from within. And with his permission, of course, we will be allowed to actually visit this neurosurgical theatre. And we also will be asking him a few questions about brain surgery and spinal surgery. Now, let us see how we can manage this in this short video as he's about to begin his MVD surgery for HFS.
Hello. So today I am going to show you some things in our operation theatre and the place where we do our MVD surgeries. As you must be knowing, we have a very well managed MVD center. MVD surgeries are done for trigeminal neuralgia, hemifacial spasms and glossopharyngeal neuralgia. So trigeminal neuralgia is a very severe pain on one side of the face. It is also called as a suicide disease. Hemifacial spasms are spasms on one side of the face, wherein when a person starts speaking, then the face moves like this on one side, either this side or this side. Glossopharyngeal neuralgia is a neuralgia when patient tries to swallow something. There is a very severe pain in the throat or in the ear. So for this, there is a surgery called as microvascular decompression, and I think I can say with pride that our team has been working in this field for the last 15 years, and we have the largest series perhaps in the whole of Asia. So the entire team is important, so I am trying to show you the theatre complex where we do these surgeries. Along with this, we also do difficult brain tumor surgeries, pituitary tumor surgeries, and some difficult spine surgeries. So this is the theatre complex of 6th Theatre. It is a ultra modern complex. You can see today I am operating in OT2, and this is actually a touchless technique. I am just taking my hand here and the door is opening and you can come inside. And you can see these are the panels.
So, this is the operation theatre, guys. And doctor, what are these panels for?
So this is a panel showing you different, which is showing you different parameters: gas status, oxygen, carbon dioxide, nitrous. Also, it is showing you the theatre temperature. What is the humidity in the theatre? Can you see this? Can you see this humidity? So it is also showing you humidity. How much pressure is there inside the theatre. So you can see here that there is a positive pressure inside the theatre. So what it does is, because the theatre has got positive pressure, the surrounding air cannot come inside and the surrounding germs cannot come inside. So this is a very modern operation theatre that we use because brain surgeries need these kinds of higher technologies. Here you can see this is the panel. Our team has just started this surgery. I will be joining them for the critical part, and on this panel you can see the surgery being projected, and everyone in the theatre can see the surgery. Everyone knows what is going on, what steps need to be taken, at what level I am during surgery. This is the panel which is put operative notes and put patient data. This lights up. So this entire wall is very important in this operation theatre. Everyone who is present here knows what is happening and is totally in tune with surgery. If you take your view there, you can very clearly see that there is a beautiful picture of Himalayas. That picture is very important because when the patient is wheeled inside the theatre, he should not feel that he is coming in some serious atmosphere. Also, sometimes there is a very light music, so that the person is put at ease. All our efforts in this microvascular decompression or MVD center and brain tumor center both.
Doctor, what are the other operations also which are performed in this theatre?
We also operate difficult brain tumors here very regularly, and some of the difficult spine cases, including endoscopic spine cases. And these gadgets are there to actually give information, scientific information continuously in real time. In addition to that, we have the most advanced gadgets which are used for brain surgery, like the most modern neuromicroscope, the navigation machine, the CUSA. All these technologies help us in delivering good results. So, since you wanted to know today about how the operation theatre for brain surgery looks from within, I have specifically brought you here, and I am showing this one of the most modern operation theatres. So now I will wash up and I will join the surgery, and then we can continue talking. Okay? So this is where normally we take the wash, because it is very important to wash your hands thoroughly before any brain surgery.
Doctor, how many MVD surgeries has your team performed?
So we have been operating on these problems for the last 15 years, and with special interest and zeal. Till now, taken together, recently we presented our audit and paper in an international conference. The total MVDs for trigeminal neuralgia, hemifacial spasms and glossopharyngeal neuralgia, the number I think has crossed 1300, which for this disease is a very large number. And we have follow-up of all these patients. That is very important. And it gives me great pleasure to tell you that we have dissected our results, and in hemifacial spasms, the success rate that our team has is 99%.
Great.
It's slightly more than 99%. I think point something, you know how this statistics works. So, so round figure, let's say it is 99%. In trigeminal neuralgia, the success has been in the range of 98%. No surgery, no surgery. I always tell my patients before surgery, no surgery, even abdominal surgery or hand surgery, no surgery is without risk. But when you are performing a surgery, you have to consider the risk-benefit ratio and temporary answer. For example, I told you hemifacial spasm patients have this continuous movement like this. So their entire confidence in the life is lost. They cannot go out, they cannot speak with people, they cannot carry out their normal jobs, they cannot get married, they cannot go and work anywhere meaningfully, they cannot take part in social functions. So the life loses its meaning. And that is why I always feel that this disorder has to be cured, and you have to remove the basic cause of this problem, which MVD surgery does. Similarly, in case of trigeminal neuralgia, is a very severe pain. If you go through trigeminal neuralgia in Google, you will find that it is called a suicide disease. Why is it called a suicide disease? Because when there was no treatment, people used to commit suicide because of this pain. So it gives you some idea about the severity of the pain that these patients, have. So this needs to be cured, not just managed by some drugs which are numbing medicines, and inside the disease is going on increasing. Similarly, in hemifacial spasms, if you keep on taking some medicines or some small injections like Botox, temporarily 1 or 2 months the spasms can stop because it's a numbing and paralyzing kind of a medicine. But when the spasms come back, they come back with double strength, because inside the pressure on the nerve is increasing. So in these disorders, what happens is that this is a nerve and there is a blood vessel. These patients have blood vessels which is very near to the nerve from birth. As the age increases, these blood vessels go on elongating and they start pulsating against the nerve. As the days and months go by, these blood vessels elongate and bury deep inside the nerve. So, if you are biding time with medicines or other things, you are asking for trouble because these blood vessels are going and burrowing deep into the nerve, and when we operate in such a delayed fashion, the surgery becomes slightly difficult. We have to separate a deeply indenting blood vessel from the nerve. So I think I always try to tell patients that there is a very useful technique like MVD surgery at our disposal. We have created this center of excellence where we are focused on this surgery. So plan to cure it. This is what, as a doctor, as a neurosurgeon, as a person who has spoken with such millions of such patients for last 15 years, I can tell you with confidence that earlier it is cured, better it is for the person.
Right.
Ultimately, it is a person's choice. But for that, we have created this ultra-modern facility for MVD surgeries in Pune. And now you come inside, I will show you what is.
So MVD is the only potential cure which can give you permanent relief.
MVD is the only potential cure which can give you permanent relief. With a caveat that I feel this surgery should be done by a team which does it very regularly because it is slightly offbeat surgery. It doesn't, I don't mean to imply that nobody else can or should do this. But the results obviously are better as you do more and more, and the complication rate goes on reducing as you do more and more.
So you become experienced in that.
The whole team becomes experienced. During surgery, after surgery, the whole team becomes experienced. And also we have a very important emphasis on all these modern technologies, which has actually helped us tremendously in improving the results of MVD surgery. So we'll just wait for some time, let me join the surgery, and maybe during surgery when I have finished some critical steps, I can speak with you again.
Sir, the chair which you are sitting on, so what is the purpose of this chair?
Determine the outcome of any brain surgery like brain tumors or MVD or vascular brain surgery. And one of the important factors that has been focused on recently is the sitting comfort when you are operating, because some of the brain surgeries go on for a long time, maybe 6-7 hours. Not MVD, MVD goes on maybe for 2 hours, but if the surgeon is comfortable, if his hands are rested, then obviously his control on the equipments is better, and that is why the outcome is always better.
Right.
So the chair that I am sitting in, it is made by a company called as Stryker, and as you can see here, this is a handrest which can be adjusted, and I can take the chair down like this, and I can pump it up like this, depending on the height that I need. My hands will be resting here. So as the wrists are not under duress, my fingers can do the delicate work. So this is the entire purpose behind designing of the chairs. Okay.
Okay, sir. In the morning, you were describing about the modern neurosurgical theatre.
Yeah.
So this is the second MVD you're performing.
Yeah. This is the second MVD. Today we are performing. We have two microvascular decompression surgeries.
Okay.
Both have very severe hemifacial spasms, and they have come from very far away from Pune, different parts of India. Normally, before this COVID era, as I call it, before COVID started, on an average we used to perform about 4 to 6 MVDs per week. And as you can see there, you can actually see on the monitor surgery going on. So the anesthetist can see it as well as the assistant, so that they can, help properly.
So this was a neurosurgical operation theatre. Stay tuned for more such videos. Till then, take care and bye-bye.